Oral cleaning methods for children between aged 0 and 6. Parents should regularly clean their baby's mouth every night starting at birth. Aim: to keep your baby's mouth clean. To help your baby learn to brush and be accustomed to brushing when he or she grows up. To get your baby accustomed to having a clean mouth. Steps for cleaning your baby's mouth. Prepare a piece of gauze, cotton or cloth and a glass of drinking water. Wash your hands thoroughly with soap. Wrap the gauze, cotton or cloth around your finger and damp it with water. Gently put your finger inside your baby's mouth. Wipe the upper and then the lower gum pad once. Common problems for cleaning baby's mouth. If my baby does not want to open her mouth, then how can I clean her mouth? When you put your finger near your baby's mouth, your baby will slowly open her mouth as he or she thinks that you are trying to feed her. Try it with patience and you should be able to make your baby open her mouth. What if my baby bites my finger when I tried to clean her mouth? It is natural for your baby to bite your finger when you tried to put your finger into her mouth. Keep wiping her mouth and it will be opened again. I cannot reach the gums at the back of my baby's mouth. What should I do? You can slip your finger at the corner of your baby's mouth and then reach inside along the inside surface of his cheek until you reach the gum at the back of the mouth. At this point insert your finger gently in between the upper and lower gums, as shown in the picture. Your baby will open her mouth and you can wipe the gums at the back. When is the best time to wipe my baby's mouth? Since newborn babies have not established a regular feeding pattern, it is difficult for parents to decide which meal will be their last meal of the day. Parents can then set a fixed time to wipe their baby's mouth every night. When your baby grows older, over 6 months old, and has established regular feeding habits, you can wipe your baby's mouth after the last meal of the day. I fed my baby and wiped her mouth before putting him to bed. Yet he or she did not want to go to bed and asked for milk again. What should I do? The reasons for wiping your child's mouth after the last meal of the day are to get your child accustomed to cleaning her mouth regularly and going to bed with a clean mouth. Generally, it is only out of habit that children ask for milk before going to bed. Parents can feed them with water, or keep them preoccupied by patting, singing a song or telling a story. If ulcers, ulcer, are found inside my baby's mouth, should I stop wiping his/her mouth? You should keep wiping your child's mouth, avoiding the ulcer, if not possible, then stop wiping until the ulcer has healed. In general, ulcers will heal in a week's time. When the first tooth appears, parents should wipe their children's mouths and teeth every day. Following the eruption of incisors, you can start brushing your child's teeth with the soft infant toothbrush and drinking water. You can also use an infant toothbrush, as shown in the picture, to get your child accustomed to toothbrushes, which will become essential when the molars come in. When the first molar comes in, parents must brush their children's teeth twice a day in the morning and before bed at night. For children under the age of 2, parents should pick a toothbrush with soft bristles and the brush head size should be approximately the diameter of a Hong Kong 10-cent coin, 15 millimeters. Make sure your child knows how to spit before using toothpaste for brushing. To effectively clean your child's teeth, it is important to use a correct toothbrushing method. It is best to follow a sequence during brushing. Start with the cheek side of the teeth. Repeat on the tongue side of the teeth. Finally, brush the chewing surfaces of all molars. When you brush your child's teeth, you can either let your child sit on your lap or lay your child on a bed, so that you can see the teeth of your child clearly. Parents should allow their children to learn to brush the teeth on their own when they are 2 years old. Parents should allow their children to learn brushing the teeth on their own when they are 2 years old. Parents should get their children a new toothbrush, with the length of the head less than the diameter of a 20-cent coin when their children are between 2 to 6 years old. If your child knows how to spit, you can let your child brush her teeth with a pea-sized blob of fluoride toothpaste in the morning and before bed at night. Since your child's fine motor skill is not yet well developed, he or she might not be able to master the toothbrushing skill, and you need to follow up by rebrushing her teeth thoroughly every night. When you brush your child's teeth, you can stand behind him, her at the side and tilt her head slightly upwards by supporting her chin with one hand.